All right, so, the producers always ask me to ask you to take your children out of the room if you don't want to hear them us talking about sex, okay? Okay, and that's why we put Raul in the kitchen as well. So Dr. Goldstein, Dr. Hartzell here from Alvarado Sexual Health. This is what you do for a living, you two. You guys are the best. You are, Dr. Goldstein, we are talking about discomfort for women during sex, especially and specifically during menopause.
Correct.
Now, is it specific to menopause, or can you have pain at any age?
Well, you can have pain at any age, but specifically in menopause, the ovaries cease to synthesize very critical hormones, especially estradiol, and your tissues at the opening are estradiol sensitive. So we see that.
Is it common? Is that common during menopause?
I mean, it's like 90%. Really.
Okay, and is it an easy fix, or what are we talking about
so here? It's an easy fix if the woman is willing to seek a specialist care and go on the various treatments. But they have to discuss it. And today, I think what we're going to do is talk about communication skills.
Well, Dr. Hartzell, we were talking about you in the last segment last week, and you weren't here. So nice to bring you back. Last week, we were talking about, or the week before, erectile dysfunction.
Correct, yes.
And I asked Dr. Goldstein, if a man is in denial, how do you recommend or say, hey, maybe you should go to the doctor? Like, how do you talk to him about that? And I think that's probably something, do you see that in your office very often?
Oh, totally. And there's kind of 3 ways that I would deal with that. Okay. One is to bring it up at a neutral time. You don't want to
Not during sex?
Exactly.
Oh, okay.
2 is you might want to bring the conversation up by asking him if he's noticed a change at all. And if he's in denial about that, then also when you
No, he's in denial.
Okay.
He's in denial, Rose. That's why, if you're that far down the line that you have to ask, like, hey, have you noticed anything? He's long gone denial. Denial way in a river in Egypt, like long gone. Honestly,
so
how do you do it?
It's ridiculous at this time in history that anyone should have to live with ED. There's so many things that we can do for it. And unfortunately, having ED could be a sign of many medical issues. And so even expressing that, hey, I care about your heart, I'm worried about your health, I would like you to see either a sexual medicine physician or your primary care physician.
Is that the same for women? Because there's women who are in denial, right? I guess women just try to power through it and not tell anybody that they're having this excruciating pain during intercourse. Really?
We see this all the time.
Really?
Yes. And
you don't have to do this, ladies. You do not have to do that.
Please, thank you. Can you say that one more time?
It's supposed to be pleasure. It's not supposed to be pain.
It actually leads to more sexual problems because then the woman starts to have low sexual desire because who wants to engage in something that's painful?
And then the dominoes start falling in the relationship, emotionally, physically, right? And then they're in your office every day. So what do you guys think? What's the answer here?
So the answer is to see biopsychosocial evaluation system as we have in our facility. I deal with the biology. It's important to have a sort of a need and a want to do that. And we can take care of men with ED and women in menopause with pain. But they need to have a couple's discussion about their problems, and they need to do that.
All right, so if you guys want to get in touch with these two, go to fox5sandiego.com and click on the Scene On button. We'll get you hooked up with them. They're right here in Alvarado, so you can go see them anytime. You what?
I have 2 things.
What?
Can I do them?
What's that?
Okay, so one thing is if women do have pain, we're doing the first in the United States trial. We always do the first in the United States trial. The drug is called ospemifene. It's actually FDA approved for women with pain in menopause. That's the
Is it
indication.
estradiol? Is that what it is?
It's a sort of a SERM. It's a different version of estradiol.
Okay.
And what we're doing is taking pictures called vulvoscopy. And we're doing it before, during, and after treatment to show the benefits of the drug. It's actually never been done. It's a very cool study.
Interesting.
The next thing is February 18th. We have our free public open seminar for women. It's only women. You can't be a man and attend.
Okay.
Dr. Hartzell will be there, and we're going to discuss again the women's sexual function early in the beginning of the year, around Valentine's Day. So women with problems and men with problems.
Ladies' night out.
Deal with it.
Ladies' night out, February 18th at 6 p.m. Thank you, too, for what you do.
Thank you.
There's so many. You guys just, hey, keep it pleasure. You know what I mean? It doesn't have to be painful. It should be fun. Guys, thank you very much. If you guys want to, get on their website, go to our website. We'll get you hooked up. Raul?